Today we are going to discuss the bony features and attachments of fibula. Fibula is the bone of leg which lies on the lateral side. This is not a weight bearing bone. First of all, we'll discuss the side determination of this bone. The rounded part is the upper end, this pointed part is the lower end, and this slender structure is the shaft. The upper end has a styloid process that is lying laterally. The lower end has this pointed structure that is lying laterally. The lateral surface is subcutaneous and the medial surface has this articular facet that is anterior and this malleolar fossa that is lying posterior. So if we hold it like this, like our thumb in the malleolar fossa, we get to know that this is the bone of the left side. Now the bony features of fibula. First of all, this expanded portion is the head and the constricted part just below the head is the neck. On the head, this is the apex, the highest point, which is also called the styloid process. This structure, which is a smooth structure, is the articular area for articulation with tibia or the superior tibiofibular joint. Now coming to the lower end, this is the lateral malleolus. The lateral surface of lateral malleolus is subcutaneous and the medial surface has a smooth articular area for talus anteriorly and this fossa, the malleolar fossa, lying posteriorly. And just behind there is a groove for the passage of the peroneus longus and brevis tendons. Now coming to the shaft of fibula. From the anterior surface of fibula, this line is the anterior border. It ends below into a triangular area. So this is the anterior border of fibula. Just posterior to the anterior border is medial border, this one. The gap between the anterior border and the medial border is very less in millimeters. So this is the medial border lies just posterior to the anterior border. The area between the anterior border and the medial border is very less in millimeters. It ends below just above the articular facet. Now posteriorly there is a round posterior border that ends on the posterior side of the lateral malleolus. So the surface between the anterior border and the medial border is this thin anterior surface or the medial surface. The surface between the anterior border and posterior border is the lateral surface. And the surface between the posterior border and this medial border is the posterior surface. Now the posterior surface is further subdivided into two surfaces by this sharp medial crest. The medial crest is in the upper 2/3 and it disappears in the lower 1/3 of the fibula. Medial crest divides the posterior surface into a posteromedial surface and a posterolateral surface. Now we'll discuss the attachments on fibula. So on the upper end, just behind the styloid process, the posterolateral to styloid process, we have attachment of biceps femoris muscle. On the neck, the common peroneal nerve winds around this thin neck of the fibula. Then on the lower end there is a facet for talus bone and it forms a joint with this with talus. On the shaft, this anterior surface or the medial surface that is lying between the anterior border and the medial border has attachment of 3 muscles from above downwards. Upper muscle is the extensor digitorum longus, the middle muscle is extensor hallucis longus, and the lower one is the peroneus tertius muscle. Then coming on the lateral surface, that is between the anterior border and the posterior border, there are 2 muscles attached. One is the peroneus longus muscle, which is in the upper 2/3 of the shaft, and one is peroneus brevis, which is in the lower 2/3 of the shaft on the lateral surface. These 2 muscles, the peroneus longus and brevis, are the muscles of lateral compartment of leg. Then we'll discuss the posterior surface. As I told you before, the posterior surface is divided into 2 surfaces by this medial crest. On the posteromedial surface, we have attachment of tibialis posterior muscle in the middle 2/3, and on the posterolateral surface, above we have attachment of soleus in the upper 1/3 and below we have attachment of flexor hallucis longus in the lower 2/3.